Oh my God, are we live? This is hilarious. Here I am trying to figure this out. I'm so sorry. It took me a second and my computer started acting up. I had everything ready for you. So welcome to my channel. My name's Sarah Lavonne and I am a labor and delivery nurse turned birth coach, turned everything related to birth. So welcome to Coffee and Questions. Coffee and Questions is my monthly series where I answer your questions live. You're gonna have to bear with me. First of all, Jordan, I know you're here, I see you. Am I oriented right or do I need to flip my screen? Are we crooked? Because I originally had this set up on my computer and then my computer couldn't figure out where my camera was. So now I'm on my phone. I know some of you have been waiting. I announced it on Instagram. So if you don't, okay, flip. Thank you. Flipping is easier anyway. So I actually like this idea. It feels like Instagram Live. We good? It's Sarah from Hawaii. Hi, Sarah from Hawaii. Happy New Year, everyone. I am literally sitting here looking at my dining room table that I am setting up for a very small COVID safe, double date-esque YouTube, New Year's Eve party. So I see all your flips. I'm flipped now. So anyway, welcome to Coffee and Questions. I'm excited to go live with you because it has been a second since I have been live with you. And if you haven't been to my channel before, if you haven't seen the Coffee and Questions series, Coffee and Questions is my opportunity to connect with you and answer your questions. Labor and birth is weird. It is so not concrete as you've seen and as I've seen with the comments that have come in as you tell me your birth story. And so my goal as your kind of guide in this area of childbirth, I'm kind of letting everyone log on, that is to kind of help you understand as much in a very general sense of what's going on. I did set up a cute little background and everything. I'm trying to see if there would be a way for you to see that instead of my TV. Let's do that. Cool, I'm in sweats with a sweater, FYI, you can see that. So we're just keeping it real here. Have some questions by the fireplace. That's not a fireplace, candle place. So I'm gonna have to look at my computer because all my questions were on my phone, but I have saved some of your questions from previous YouTube videos. That's what Coffee and Questions is. I connect with you, I can answer some of your questions from there. Mind you, they are not uploaded, or are they? Lovely. Okay, so I'm gonna pull these up and have them ready for you as you're logging on and as you're asking your questions. And so if you have a question for me, for those of you that are here, one of the perks of being here live is that I will answer your question live, all right? So Emily Gwynn says, I have a question. What's the purpose of using a Cook's catheter for induction? So if you have seen my induction videos, I have two very thorough induction videos. One is, does induction work, all about induction. Then the other one is what's the process like? And I talk about a Foley balloon in that video. So I will send you to that video. So I'm not repeating myself 500 times, but the Cook's balloon is a type of Foley balloon. It's actually not, I see that. Jay, I see you. It's actually not the one that I showed in the video. It's a double balloon. So if you go back to that video and you see there's a round balloon that sits on the cervix to put pressure on the cervix to help it dilate. Instead, the Cook's is two balloons that smush the cervix from the bottom and from the top. Personally, the second hospital I worked at did not have Cook's balloons. The first hospital did, and my favorite was the Cook's type. So if you're being induced, the purpose is to help soften and smush and sort of help dilate mechanically, meaning with pressure, actually literally touching the cervix without medications. So that is the purpose, to help get you into labor, hopefully. Very uneventful for somebody. Okay, perfect. So Katie Bauer, I see you. Hi, I was wondering if you could give advice on when it's considered safe to get pregnant after giving birth. Very uneventful first pregnancy, which I was very happy for. So this question is, I'm gonna say probably the most common question I get in any social media avenue by my clients. I literally had this question a couple days ago. I had a birth yesterday. Technically, she delivered yesterday, early morning. So I was at a birth in the hospital, which was really fun. And so the medical recommendation is to wait 18 months to conceive, no matter what your delivery was, whether it was C-section, vaginal, uneventful, not. Here's where I have like realistic caveat in my head. How many people get pregnant before that? A lot. So flex and flow on that one. If you've had a C-section, I'm gonna say 18 months because we really want that C-section scar to like get strong and stuck together. And so 18 months for a C-section, obviously. Now, for those of you that are like, oh my gosh, I got pregnant before 18 months and I'm freaking out about it, don't stress. No big deal. You know, you're pregnant now, like there's no going back. And it's still in theory okay. It's just as far as like mitigating risk for your birth, for delivery, even just it going faster. Because I will say that's like the first thing I think about for people that have babies back to back. Like that second baby like happens a little bit faster. So that's my answer. 18 months is the recommendation, flex and flow. Also, you have to think about like your lifestyle factors, family planning. You're like, I'm 37 already and I want to have 3 kids. Like you maybe don't have 18 months to wait to get pregnant, then add another 10 for pregnancy plus recovery. Like, so that's that. Perfect. All right. I see all your comments here. It's so fun. I want to know what your New Year's plans are, by the way. I am celebrating right now. I'm going to continue to decorate my house for my little shindig I'm having tonight. You saw that. Oh, I love this. Okay. Moliboang Sane. I hope I say your name close. She says, what's the best advice for a new doula starting out? Do you offer any courses to certify in childbirth education if you do not, if I do, or do I in the future? Oh goodness. Okay. So clearly like God's trying to tell me something because the number of people that have come to me recently, particularly looking for doula support. So if you don't know what a doula is, I'm just going to say off the bat, you should, because if you're pregnant, doulas are the number one most evidence-based, least costly way to decrease your risk for like everything for your birth. Okay. Now, mind you, you want a good doula, you want somebody that's actually supportive, but a doula is going to be somebody that has some level of knowledge of birth and they are physical and emotional support during your labor and birth. So they're there the whole labor. I am a doula. I can't legally call myself that publicly because I carry a nursing license, so I can offer my nursing knowledge to my clients. I was at a birth 2 days ago and she texted me in early labor. We sort of like discussed when to go to the hospital. What are your sensations? Here's how you cope. And then when she went in, I met her at the hospital. It was her second baby. A lot of times I'd labor at home with them and help them know when to go to the hospital. And then I was with them until she fed her baby, which was about an hour and a half, 2 hours after her birth. And so this is something that you can do. Now, for those of you that are doulas, you're interested in becoming a doula, tell me if you're like, ooh, I want to do that job, because it's really a very rewarding job, to be honest. And if you're really into birth and you like being that emotional support, I think it's a great option. I 100% have dreams for doulas in the future. I will say that I can officially tell you that I have launched and registration is open for my very first physiologic birth class for doulas or birth workers. So this is a lower level class without expecting you to have any prior medical knowledge. I teach this class to hundreds of nurses and providers, so doctors, midwives, worldwide, and we spent an entire year teaching them, and I think that you should have that knowledge too, because there's a lot that you can do within your scope. So come to that class. It's open on my website. I will put the link down below, but otherwise it's bundlebirth.com, and then you can click around and find it for birth workers. So that's number one. Yes, I have plans in the future. My best piece of advice would be to I have a few. This is probably a YouTube video. If you want it, let me know. Would be to process your own trauma and your own upset with what you see and the medical system, so that doesn't affect the care that you give. And that is a whole nother deeper conversation. But I think that, and the other thing is along those lines would be like work on your ego, because I think I see a lot of times doulas feeling like they have to prove themselves at the bedside, or they're so upset with the system, and maybe some obstetrical violence or some other things they disagree with in terms of how care is provided. And that ends up making them bitter and anti and aggressive and sort of just like not collaborative. And to me, the best case scenario for the sake of the families that you serve is that everybody's collaborative together. So, hi, Kimberly Williams. Thank you for sitting there watching me. Okay, so that's enough of that. I'm trying to, you know me, I can talk. So, Kylene Wasco, will I still be able to make it to term with a heart-shaped uterus? And there's lots of different shapes of uteruses. Again, whole YouTube video, but the answer is flex and flow. Most people that I've taken care of plenty of patients that are like, I have a heart-shaped uterus, and they're at term and they're in labor and it literally doesn't affect anything. Sometimes depending on how like deviated the uterus is, and that's like, sometimes you can have like a septum in your uterus and it kind of pulls it in. So the top part of the uterus is like this. You know, there is risk involved, but if you've carried there and, you know, I can think of plenty of times that I've taken care of patients that they had the heart-shaped uterus and it didn't affect them at all. Sometimes, again, that's what I was going to say, that the pregnancy can kind of push it out, and then it's no longer an issue. So very much flex and flow on that one. Morgan, how successful is manual manipulation for a breech baby? So I talk about this in my how to turn a breech baby video, and I specifically, you'd be looking for the ECV information. So this is external cephalic version, and that's where they literally like smush and pull on the abdomen to physically turn a baby who is breech, meaning butt down, so that the baby is head down, which is ideal for a vaginal birth. It is very successful. Now, numbers, I have like the actual nationwide number in that video you can look up, but I think to me, sort of a side note is to ask your provider who's gonna be doing it what their success rate is. And that goes for any time you're working with a provider. What's the national C-section rate? Well, it doesn't really matter because you're being guided by your provider. So what's your provider's C-section rate? There's providers that have a 2% C-section rate. That's low. I lie. Let's say 12% C-section rate, or there's ones that have an 80% C-section rate. And if they have an 80%, you have 80% chance you're having a C-section versus what the national standards are. So the same thing goes for an ECV. I would ask them what their percentage success rate is. I've seen so many beautiful ECVs that are like done and wham, bam, and they have a vaginal birth. I did one last August, actually, and it was super successful, no problems, all that. Okay. Cute. Okay, you have so many questions. I'm like not gonna get to the questions that I pulled, but that's totally fine because I can save them for next month too. So as a future reference thing, if you are watching this video back where it's not live, comment on this video with your future question you want answered in a future Coffee and Questions, and because I very much look at these videos for your questions. Ooh, I love this doula interest. Membranes, to sweep or not to sweep. So I have an actual video all about membrane sweeping coming. My answer to this would be flex and flow, whatever you feel comfortable with. If I'm gonna give you the nitty gritty sort of sneaky Sarah answer, I am super pro membrane sweeping. I think it's a very low risk, low intervention way to just like bump you into labor versus like a full-blown induction. So I'm constantly encouraging people to have their membrane swept if that's an option for them, but you have to feel comfortable, and you also have to know it's sort of uncomfortable. So stay tuned. Make sure you subscribe down below so that you don't miss that video, because it's actually in the queue. I think it's up next to film this month. All right. Q3NT69 says how to increase or up platelets. I think you probably asked this question on a previous video because I did have it in the queue over here. I don't have anything off the top of my head. This would have required me to do some research, which I did not do in preparation for this. Off the top of my head, I have no way that I can think of to increase your platelets, unfortunately. It's one of those like medical things that very much is just, it is what it is. You could have a platelet transfusion, and they actually give you platelets in your blood, like a blood transfusion. That's the quick nursey way off the top of my head to increase your platelets, and probably the most effective. There's probably some actually there are some medications you could potentially take if your doctor recommends it, usually not recommended, but I would say if you have a thrombocytopenia of pregnancy, which is low platelets, which is your clotting factor to help prevent you from bleeding, that you're being followed by a high-risk doctor and they're going to advise you. But I wouldn't stress that it's your fault because it's sort of just one of those like random things that happens. Oh yeah, that's a good one. Hold on, I don't want to miss anything here. Due in 2 weeks. Cute. How to up platelets. Okay. I just wanted to ask, so this is Snia. I hope I said your name right. Hi, I wanted to ask if it's okay to breastfeed your baby after you've had an abscess. I'm due in March and I've had an abscess 3 years ago due to breastfeeding. 100% absolutely totally safe to breastfeed. Now, my guess is it was probably an abscess related to mastitis. Which is usually like an engorgement, lead to clogged milk duct, lead to mastitis, lead to abscess, which is the risk of mastitis. So I'm making that assumption. And I would say that you are probably at increased risk for mastitis this time around. And so to do all the preventative measures to avoid it, which is a YouTube video, let me know if you want it. Okay. So yes, you can breastfeed. I'm due in 5 weeks with my third baby. I have a feeling a lot of pain in my lower abdomen around the pelvic area when walking. How normal is this? Because I didn't experience such sudden pain with my first. Sometimes it comes to the point where I can barely walk, feel it in my legs, will give out from under me. Ooh, that's terrible. Okay, so the question is, I've been feeling a lot of pain below my abdomen around the pelvic area when walking. How normal is this? This sounds probably the most common answer. I'm not your doctor. I'm not your provider. Always go to your provider about this. It sounds like a cephalopelvic disproportion. Listen to me. To an SBD, which is where the pubic bone ends up. Like the symphysis pubic dysfunction is the pubic bone. Look, you can see my makeup here. I need to wash my hands. That the pubic bone, there's like a cartilage that sits in the front of your pelvis, like right on the top of your vagina crack. So you can like feel that, like feel at the top of your vagina crack, and then it's firm, and then it gets smushy, and you can like press on it, and you'll press on your bladder. If your bladder's full, you'll know you got there. So that hard bone right there starts to soften and can shift, and that can cause a lot of pain, like right on your mons pubis, which is like the area where the pubic hair would be. So that's my first guess. I have a post about that, and on Instagram, so follow me over there. And then I also I did a whole thing on symphysis pubic dysfunction in a previous video. I will talk about what to do for that. I'm watching you. So fun. I'm a retired labor and delivery nurse serving as a doula and in-home childbirth educator. We're like the same person. I want to provide more holistic care than I could in the hospital. Then you need to come 100% to my physiologic birth class. Or you could go to the nurse one. If you're a nurse and you have that knowledge, you're good. Have I heard of a monotrese? Of course I have. So a monotrese is a nurse, usually midwife, that provides doula-related services, so not the actual perinatal care as like a midwife or a doctor, but they follow them along their pregnancy, and they can provide more like medical related services. So they can check a cervix, do a vaginal exam or cervical exam. They can listen to heart tones of the baby, make sure baby sounds good. They could take blood pressure, whatever they decide is in their scope. So I do know about that. The problem with me that I have with monotrese is the legal side. Of course, I'm a medical provider when I am practicing very much independently, which I have to know my scope of practice very well. And there is no like scope, and the Board of Registered Nursing doesn't really know what to do with monotreses because it's sort of like a made up profession. So I don't check cervix. Well, I do check cervixes if I have a doctor's order too, and I have a whole form my clients can fill out. But past that, I don't listen to heart tones. I palpate an abdomen, do some Leopolds occasionally to like see the position of the baby, and past that, that's really all I choose to do for the sake of liability. All right. You are so great. I'm loving seeing all of your comments. So keep them coming. Hi, Caitlin. Oh, Caitlin is Jalen. Perfect. You are so welcome for all of this. Polyhydramnios. I had it with my second baby and was induced. Waters were everywhere. Yes. Is it likely to happen with my second? Again, that's another thing I would like, if anything, numbers wise are not good for lives, if I'm going to give you like actual numbers, but I'll give you anecdotal from my experience, which is extensive. So if you've had polyhydramnios, I think you are at higher risk for polyhydramnios again. So polyhydramnios is just excess amniotic fluid. It can be a side effect of other kinds of pregnancy, especially like the first one that comes to mind is gestational diabetes. But it can just also just happen out of the blue. We have so much water. So you can imagine when your water breaks, it's like a geyser coming out of you. And I will never forget, I had a client whose water broke, and literally it was like, I thought the baby was coming out at one point because there was like, her vagina was like spreading open because the flow of water was like shooting out off the end of the bed. I'm not even kidding, guys. We should do, let me know if you want a YouTube video where I just tell you the wildest stories I have from different birth experiences. I feel like that would be really fun. So that would be one of them. I have multiple of that, but she had polyhydramnios, and we still talk about it to this day. So yes, but there's, I mean, I would just say be followed in your pregnancy and listen to your doctor's recommendations based on your specific one, because there's a lot that goes into poly. How likely is it to have a quicker labor and delivery for my third baby if the second baby was 3.5 hours? Here's sort of what we say as nurses. Is that first baby takes forever. That's like pave the way, right? Second baby, you blow it out. Like it just super fast. I just did a labor that was 8 hours for a second baby, which her first, she was induced. She went pretty fast with her first anyway. But like 8 hours, she was contracting 3 hours before she had to go to the hospital, and she was 4 to 5 centimeters, and then got her epidural and blah, 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 had her baby. Very, very quick for a second baby. Now, third babies are the wild card, that they can come faster. So you sort of want to be prepared for them to move. At the same time, they also can be like, why hasn't she had her baby yet? Like, this does not make any sense at all. So especially from a nursing perspective, like I'm prepared for all things for third, because it can just take longer. Okay, I apologize if I missed your question. To be honest, I'm having to scroll back every time, so I will do my very best. Does meconium make birth more painful? That's actually like a very good question, and probably one that I've never had before. So this is the Gucci's 6'5" and Mealy. The answer to that is profoundly no, it does not. It actually doesn't affect your labor discomfort whatsoever. Meconium is when the baby poops inside prior to coming out. So when your water breaks, you can watch my water breaking videos on that. The water should be ideally clear. It can be yellow, green, brown, chunky, not clear. Anything not clear means the baby pooped inside. It kind of gets absorbed and mixed in with the amniotic fluid that's there. And so, yeah, that can happen. I have talked about meconium in other times, but no, it doesn't make your labor more painful. She just deleted her message. Sorry. Hi, Ashley. All right. I mean, there's a hole in the amniotic sac, the umbilical cord. Wait. Oh, that's actually very interesting. Okay, I don't have my props on this side because I'm in my apartment. My office is across the way. Selena. Okay, this is super interesting. Okay, so part 1. If the placenta is attached to the uterus, the umbilical cord is attached to the placenta, and the baby is inside of the amniotic sac, does this mean there's a hole in the amniotic sac that the umbilical cord runs through? Yes. I mean, not a hole, but they're all connected. So there's no hole that like it lets the water escape, but it's like, to me, I wish I had my props. So you have placenta, okay? The placenta is stuck here, and then out of that and stuck is the amniotic sac, right? And then inside of the placenta is the cord. So it's like the amniotic sac is sort of stuck to, in some ways, the placenta. And then the vessels traverse, or they go through to the placenta. So they're not all one unit. They're separate like things, separate anatomy in the body, but there's like a stickiness to the placenta and the sac that adhere to the cord. I don't know if that actually answered that question very well, to be honest, because I feel like I need props. Okay. I don't want my water broken. I want it to happen naturally. Should I wait to go to the hospital in this case? Great question. So if you don't want your water broken, I would just say, don't break my water. And if they were to pull out, and I show this in my induction video, how do they induce you in the hospital video? So go there so you know what this looks like for the prop. But if they pull out this little yellow thing to like break your water, they should ask you again, like I can't control the consent that's given by your provider. So Flex and Flow, but I would put that on your birth preferences. You can purchase my birth preferences sheet and packing list for like $5 on my website. Everything's in the link down below. You can check that out after. Also, do we want a sale on my classes? I was going to do that. And those of you that haven't taken a childbirth class, I was going to do a New Year's sale. So I will also, somebody tell me what they want the promo code to be, and I will give you a percentage off of childbirth classes with that promo code after this is over. So if you're watching this back for the next, we'll say week, all of everything is on sale on my website as far as childbirth classes go. So you can check that out. Anyway, reminded me because otherwise I would have forgotten. Just say you don't want your water broken, put it on your birth preferences, and then anytime they go to check you, just say, I really want my water to break naturally. Please don't break it. And if they do, technically, to be very quick and easy, that would be against your wishes and against what they should be telling you and is not okay. So Happy New Year from Dominica. Hi. My baby prefers my right side. Any idea why? It's kind of, well, no. Maybe your placenta is on the left side. So like, it's like, oh, when I rotate this way, I like into the placenta, bang, bang. That might affect it, but otherwise it's probably just preference. And it might be the anatomy inside, or just kind of where they've settled inside. But that's what I got. Also, yes, we want to hear all the wild stories. Okay. I gave birth 12/17. I have a cervical uterine prolapse. Now since still, it's still early though. Probably stage 2. Doctor says it may resolve itself. Have you seen this resolve on its own? I have seen it resolve on its own. I would also say that like sort of be proactive about at 6 weeks, if things have not improved, that you're getting to see a pelvic floor therapist. But yes, I have seen it resolve on its own. Good, I'm getting to the bottom, guys. This is great. Okay, so if I get pregnant again, I want to VBAC or have a vaginal birth after a cesarean. Is there a time limit recovery between C-section and VBAC to help prevent rupture of the cervix? It's actually rupture of the uterus, and the answer is 18 months. See what I mean by this being the most common question that I get? I love it. So the answer is 18 months before you conceive. Just finish my exercise. Thank you for responding. Quick question then. Is it possible to prevent symphysis pubic dysfunction by exercising through the pregnancy or be in shape overall? Honestly, a little bit just for like structural support, but I see it happen with people who are like professional athletes still having it. So in general, like usually there's an SI joint belt you can get, like even on Amazon if you're in the United States, well, even if you're not in the United States, I know Amazon's everywhere, but an SI joint belt. It's actually in my pregnancy list on my Amazon list, which is also down below. That's sort of my answer to that. Thanks for the sale. Hubs and I work crazy hours and want to try to find classes online. I got you there. They're all online, all on demand, and they're lifetime access. I will say too, is that the link with the download expires in 30 days. Just download that, save it somewhere, and then you won't have to reach out again. But if for some reason you can't access your class, just email us and we'll send you the link. Okay. Close. Oh, cute. Crystal, you little sneaky deaky. Okay, so you chose the promo code. The promo code can be Flex and Flow 15. That's what it is. Flex and ampersand Flow 15, which it's not made yet. So give me like 20 minutes and then check my Instagram stories for when it's live. Because you got, if I remember, 15 follicles from my last round of freezing my eggs. Hallelujah. So you definitely saw that on my personal Instagram stories. So Crystal, I appreciate you for that. That will be the promo code. And I have my next YouTube video is a fertility update with the official results. And then also what I did differently to get a better result. So your little preview, if you haven't seen my stories when I was doing them live on my personal, it went better this time. And I can't wait to tell you all about it and just tell you all the things I did differently this time around. Okay, Gabrielle ACK, do you recommend seeing a pelvic floor therapist before birth to help with delivery? I've heard different opinions, 34 weeks today. I 100%. Okay, so here's the thing. And this is where I might get a little feisty because why not have more help before from like expertise that could potentially help you, right? So that's where I'm like, why not? You know, especially if you have access to it, if it's covered in your insurance, get a referral from your doctor. It may be, depending on your insurance too, it should be. So totally, why not? And they'll set you up to let you know, are we softening or are we tightening your pelvic floor? And what are some strategies for your labor and birth? How do we push? All of that. They are experts in that. I think here's the deal, like sort of my side note on that is, I will say that I think that the medical community, OBGYN, midwife, nurse, the medical side is unaware of the value of pelvic floor therapy or some of our other alternative therapies, acupuncture, acupressure, massage therapy, fascia work, chiropractic, all those extra things that I think I kind of believe, like, especially if you have the resources for it and the access, which I know not everybody does, that why not have excess support for your pregnancy to set you up. So go see them. Sylvia says, can I start on raspberry leaf tea now once I've reached 37 weeks? I'd like to ideally bring the labor naturally or else I'd have to be induced in 10 days. So yes, you can absolutely start red raspberry leaf tea. And then everything else that I suggest for sort of helping kind of push things along is in my how to induce your baby naturally video, which I will send you to for other tips. Okay, Denise Kloss. I totally probably didn't say your name right. With my third baby, my midwife said my uterus was tired and wasn't contracting on its own, so they gave me Pitocin. I was very happy with our L&D. Why was the uterus tired? I think this is just the perfect example of how important our words are as medical providers. So this is your inside scoop if you're not a medical provider, but I also know that I have an entire community of bundle birth nurses out there. So shout out to you. If you are here, my challenge to you would be to be really, this is again, just like perfect example of how important our words are in terms of being really careful the words we choose. Your midwife, is unable to identify whether or not your uterus was tired. There's no test for that. You can assume maybe that could be the case. I'm not saying that's not an option, but that word choice was probably just the way that it was, she chose to describe it. Now, more likely and more objectively would have been your uterus isn't contracting super regularly or your cervix isn't changing anymore. And we would assume it's because your contractions are pretty infrequent or irregular. That's the case. Especially if you required some Pitocin to speed up your contractions, which is just a medication to help kind of push things along and give you more contractions to be stronger and closer together. That's more the case than saying your uterus is tired. So that may have been the other one that I hear a lot at the bedside is that your baby doesn't look happy or your baby looks so happy. There's no possible way for us to determine whether or not your baby feels happiness inside, okay? What they're referring to is the heart rate of the baby because we're watching on fetal monitors. If you're on fetal monitoring, we can see the oxygenation and an insight into the oxygenation status of your baby. Is your baby getting enough oxygen or is there concern? It's not, is your baby happy? But we say these things not really knowing how literal you're holding on to our words and why not? Because you don't know, right? And you're looking to your medical team to tell you what's going on. And so again, if you're a medical person, prompt to you, let's be objective in our descriptions. You are all grown and wise and parents. You're not sick. And you have autonomy over your decisions and you have the right to understand what's going on in your pregnancy. And so with that, it's like, we need to be more like, this is what I'm seeing versus your baby's happy, your uterus is tired. Like that's a metaphor. We can't actually say that for sure. You guys are so cute about celebrating my follicles. best. Appreciate you so much. If you haven't seen and you're like, what is she talking about? I vlogged my entire egg freezing process. And then I did it again. And I'll just say, like, the first time around was real emotional, really real. How many of you saw the anesthesia footage? I think when I saw that back, which I don't remember any of it until barely when Dr. Gadir came back in and like gave me results, I sort of remember that. Anything that happened prior to that, I have zero recollection of. And I could like almost pee my pants. I was laughing so hard. It was so funny. Okay. Hold on, let me make sure I didn't miss a question. We are almost there and we are at 35 minutes. So if you have any final wrap-up questions, throw them down here. Otherwise, I think I'm actually just gonna skip the ones that I had prepared because it's already been 35 minutes and you guys have been so fun and so engaged on all these questions. And I like doing the live thing because I never know what's coming. Laura says, is it common for doctors to let you go to 42 weeks if the baby is looking healthy? My first came at 39 weeks, thankfully, but I'd like to avoid induction if I go over 41 weeks time. Perfect. So here's the deal with induction and based on weeks of pregnancy. So weeks of pregnancy, 40 weeks is your due date. At 42 weeks, it is medically recommended that you are induced, okay? And that is because your placenta gets old, it did its job, it grew your baby to be happy and healthy. I just said what I said not to say. Let's just say healthy because we don't know if they're happy, but we assume they're happy because they're comfortable in there and they love you and you love them. So you grew your baby to a certain point and now it's like, well, I did my job and like I'm old and I like ran out of steam. And so the concern is your placenta is your baby's lifeline. That's what brings oxygen and nutrients to the baby. And after 42 weeks, there's no benefit, actually before 42 weeks even, like there's very little benefit other than weight gain for baby being inside. So you're waiting for labor. If you want to go past 42 weeks, that is absolutely a discussion you can have with your provider. And ultimately, every decision that is made is your decision. If you haven't seen my rights of your pregnancy or patient rights of your pregnancy video, you can check that one out. To me, that's the most important, most valuable lesson that I could teach you here is that you have autonomy over your body. These are your decisions. And so, but the goal is for you to make decisions that are out of the lens of really engaging with the experts that are in front of you that can teach you about the decisions that you're making because you're responsible for the decisions that you make. So all that said is, yes, you can wait till after 42 weeks. Most providers, I will say, just from habit, at 41 weeks, they're talking about induction. And that's because it's like baby's cooked in there and really there's very little benefit to staying pregnant. And in fact, some risks do begin to go up after that. So flex and flow on that one, but that's totally your personal preference. I said send in your last questions and I see like so many come in. So I'll sort of keep going a little bit. Okay. Zerosi, how often do you do these live Q&As? And then Christina says, I joined late. When will you have your next live? So I don't actually go live that much. If I'm going to go live, it's probably on Instagram. So if you don't follow me on Instagram, make sure you do. It's just BUNDLEBIRTH. But if you like them, let me know. And the more I see that, the more it like kind of puts it in my head. I just don't think to go live, to be honest, on YouTube, but I love it. And this is like so easy for me, especially compared to like the production that happens when I'm actually filming and editing YouTube videos for you. So if you want these, we can do these more regularly if you want. I think the other option, I do like the Instagram platform for going live as well. So if you want that, just let me know. And I will also let you know on Instagram when I'm going live next. So I don't have one scheduled. I'm going live with Dr. Gadir from SCRC Fertility, who is my fertility doctor, like mid-January. So you can also stay tuned on Instagram for that. I usually announce over there. Okay, I'd love to see a video about thyroid issues with pregnancy, conception, all of that. That's actually really interesting. I actually, newsflash, I was started on some Synthroid, which is a thyroid medication for this second round of egg freezing. I think, honestly, my stress this last year probably like messed up my hormones. So, yeah, I can throw that in the queue. Can your water break and yet never dilate to even 1 centimeter? This happened to my best friend and she had a C-section after 24 hours. Was she in prodromal labor? That's a 3-part question. So let me start with the first part. Can your water break and yet you never dilate? Yeah. Anything can happen. This is why I say flex and flow all the time for all things, including my life. If you've ever had a one-on-one call with me, you'll hear me say flex and flow. If you're a client, flex and flow all the time. So the answer is yes. Anything can really happen. Was this prodromal labor? Technically not, because prodromal labor, and I do have a whole video on this, is painful contractions that don't change your cervix. So I suppose if she had painful contractions, then in theory, but her water was broken, so that sort of like complicates things a little bit. This is great. Oh my God, so many questions. Okay. Is the baby head down? If the baby is head down, does that mean labor is soon? Sarah, not necessarily. Your baby can be head down for like months prior to your birth. It's a good sign, and it's something that needs to happen. But it has no really indication related to labor. How does a doctor decide which type of episiotomy to perform? Selena sent that one in. Their own judgment, their own like preference, honestly. So episiotomy is when they cut the area, usually on the bottom part of your vagina. Sometimes it can be medial lateral where it like goes sideways. So if like my head was the vagina hole, they'd cut here or over here, sort of towards the side. It's not the recommended thing anymore. So if your doctor is routinely cutting episiotomies, you can ask them about that and just say, you know, the evidence is pretty clear these days that episiotomy is not recommended as a standard of care. So that I would say is personal preference probably, or whatever they're assessing based on what's happening with your perineum. Now, episiotomies at times, just to be clear, can be appropriate for managing care. They are an option, but they should not be the standard of like, I could have an episiotomy with everybody. Not recommended. All right. Oh, this is good. Chanel, hi. What would you say about giving birth with your second child when the age gap from the first to second child is 12 years? My doctor said it would be starting over and similar labor to a first-time mom. And the answer, this is true. Unfortunately, sorry. So all the stuff you read about second-time moms, sometimes every so often you get one that like really does act like it's their second vaginal birth when the age gap is that much. But honestly, it's been so long that you're probably looking at somewhat the same like time frame as a first-time mom. Again, Sandra, is it dangerous when babies poop inside mom? So I actually have an entire video about the baby pooping inside called Meconium. It's not called Meconium. It's called something about Meconium, or baby pooped inside. And the answer to that is it can be flex and flow. So I'll send you to that video for more information on that, but it can be dangerous. Most of the time it's not. Kristen, if you had a precipitous labor for your first, how likely are you to have another? It was no fun. I'm so sorry. So precipitous labor is from first contraction to birth in under 3 hours. That is like fast. Like that is like you barely like get your head on straight. I know at labors all the time we're looking up at the clock and be like, how has it been 12 hours? How is it morning time already? Because labor, like it just makes time speed up. It is not unlikely that it will happen again, to be honest. So I would be prepared for it to happen again. I've had people that have been induced because they're so concerned that it will happen again. So you could talk to your doctor about that if it's really that much of a big deal. Good. Okay, Christina Chula, do you have any videos about tearing or changes in your vagina after labor? All the rumors have been scarring me. Okay, so this is where I'm going to answer your question, but first, all the rumors have been scarring me. This is where like I really want to challenge you to protect your mental space related to anticipating your labor and birth, the education that you do, and why I really love that you're all here, because my goal for you is to help make things that are like potentially scary sounding more realistic, understand the risks, and not be sitting there freaking out about it. Also my goal for my childbirth classes. So I do have a bunch of videos I'm going to refer you to. So one is all about vaginal tearing. One is healing your vagina. And then the peri-mom perineal massage video. I also have other information about tearing and preventing tearing in there for you. Those are the 3 videos I'm going to send you to. Okay. Oh, Nikki B. I'm so proud of you, Nikki. I have to read this. It's so fun. I love your stories of how you've used my stuff in your labor. It like, I die. Okay, hi Sarah, I just wanted to tell you I binge watched your labor and delivery videos and they were very helpful. I breathed my first baby down. He will be 3 months next week. Congratulations. Zarosi, join the fam. Join the fam. Welcome to the fun. I am not pregnant yet. Also love that. I love when you find me before that. All right. Okay, great. Crystal Elliott. Ring purchasing, maybe considering purchasing one of your programs for when that day comes. Do you do virtual? Are we back? Sorry, I think it's my internet or something. I have perfected my labor support, online virtual labor support options. And so yes, I hate to say this, but I do take a very limited, try again, virtual labor support. All right, so that's my cue. We're gonna be done. It's been 45 minutes anyway. And so thank you all so much for being here. Thank you for subscribing. Thank you for liking, commenting, engaging. You give me life. You hear me say this all the time, but I really mean that like this last year has been such a blessing and you have stuck around and you know, even like with the craziness of bundle birth nurses and all of that and building this community and all of that, the support for egg freezing, it has been the most amazing year and challenging, I know, for a lot of us, but also like just so grateful for all of you. I'm sorry if I didn't get to your question. There will be plenty of other options. I can do more lives if you want them, just let me know. And then make sure you check out my website. I have childbirth classes over there, Flex and Flow 15. But go to Instagram and you can click the link there and I'll link everything on Instagram at BUNDLEBIRTH over on Instagram and that will help you find it. And then I will see you in the new year. Thank you everyone for being here. And then until next time, don't forget to, you know this one, flex and flow, and I will see you soon.